can you be in one organization and be so ingrained in that and still find a way to be innovative? And I got asked this a lot as chief strategy officer, because my job was, and to some extent still is, sort of predicting the long range future and trying to get our organization prepared for what are those trends that are, and how do we address those to be successful and fulfill our mission. And so my job was to always cry wolf.
Welcome to Startup Health Now, the podcast where we celebrate the entrepreneurs and innovators reimagining the future of health. I'm your host, Logan Plaster. On this podcast, we like to interview a range of types of experts, from founders of startups to the chief innovation officers at insurance companies to health tech investors. But there's another category that's really important to us, and those are the heads of innovation at big health systems. That's because collaborating with a health system is such an important proving ground for any health startup. Our guest today, Scott Powder, knows all about that. He's the president of Advocate Aurora Enterprises, which is the new health tech investment arm of Advocate Aurora, the Midwestern health system that covers 26 hospitals and 500 care sites. In our conversation, which was held in front of a live audience of founders from the Startup Health portfolio, Scott breaks down the Advocate Aurora Enterprises investment thesis, and we discuss best practices for startups who want to link arms with an enterprise health system. Scott's advice is wonderfully candid and rooted in nearly 3 decades of health system strategy work, so I hope you enjoy. So Scott, let's start with a brief history lesson. So Advocate Aurora Health was the result of a merger, I think 4 or so years ago. And during that time, you were really leading strategy. So maybe you could pull back the curtain for us on that merger as a way of understanding Advocate Aurora and kind of what it's all about.
Sure. So as context, I've been with Advocate Aurora or predecessor organizations now for coming up on 28 years. As of next month, it'll be 28 years. So I was extremely young. I was an infant when I started. So, so the merger actually closed April 1st of 2018. So I guess a little over 3 years ago. And it was a merger of 2 relatively large at the time healthcare delivery systems, Advocate Healthcare in Illinois, which was where I came from, and Aurora Healthcare in Wisconsin, just north of the border. So we were sort of contiguous to each other, but operated in separate states and generally separate markets. And when we came together, just a couple things I would say about that. One is we came together because we have a belief in scale and the need for scale around efficiency. There's a huge body of literature around the correlation of scale and volume to better outcomes, particularly in surgical and procedural activity. So we thought there was a potential to advance quality by coming together. There's value to scale from a financial perspective. So we are, and one of the things that kind of makes Advocate Aurora relatively unique in the healthcare delivery space is our commitment to value-based care. So we have a huge portfolio of risk-based reimbursement, and scale is absolutely necessary and critical. We're in effect the 3rd largest insurance company in the state of Illinois, and probably almost maybe the 3rd or 4th in the state of Wisconsin, based on, even though we don't have a license, based on the amount of financial risk that we take. And as most of you know, if you're in the insurance business, the law of large numbers prevails. So scale is critical to managing volatility and managing risk, having balance sheet strength, et cetera. So we came together under, one, the belief of scale. The second reason we came together was this idea that we need to advance value-based care. We just believe philosophically that the fee-for-service system of care, which is what still finances somewhere depending on the market, 80 to 100% of all care, is a fundamentally flawed model. We also are not huge believers in upside risk sharing, like shared savings type of stuff. We believe the only way to really align incentives is for the provider to have financial skin in the game around managing the total cost and quality of care. So in order to do that, we believe that's part of what we wanted to do. And we had a lot of alignment around that. And then the last thing I'd say, which is ultimately, something to think about as we talk more about what Advocate Aurora Enterprises is this fundamental belief that while access to great care delivery is incredibly important to helping advance people's health, it is but one of many factors and actually in many cases is the least important factor in how healthy a person is. And we came together, both organizations had health care in their name, and we took the word care out of what's now Advocate Aurora Health, not because we don't provide great care, but we said, if we're truly going to fulfill our purpose, which is to help people live well, we need to address the broader health of the people we serve. Some of that is enabled by the fact that we have financial risk. So we have financial incentives to deal with things like wellness and preventative care and things of that nature. And we just believe that's the right thing to do. And so those are the reasons we came together. As Logan mentioned, I had been the chief strategy officer for Advocate Healthcare and helped work on the deal that led to Advocate Aurora Health. And until April 1st of this year was chief strategy officer. I recently stepped down to take on this role of leading Advocate Aurora Enterprises, which I know we'll talk more about.
Scott, before I jump into discussions about the enterprise side, the investment side, and get more technical, I just want to sit on one thing a minute. You said you've been there 28 years, and we talk a lot about long-term commitment and just the need to sort of raise your gaze beyond the next quarter. And I wonder if you could just speak to what you gained by being committed to something for 28 years. It's just not something that you hear a lot of in healthcare innovation.
Yeah, well, and I think it raises an interesting question. I don't have a great answer for it yet, which is how can you be in one organization and be so ingrained in that and still find a way to be innovative? And I'm not sure that I'm therefore, I certainly can't comment. You could certainly ask my boss whether he views me as innovative or not. But, I actually did an interview with a firm called Foresight Health. They publish like a weekly newsletter. And that was one of the questions they asked me is, how can you be an insider and be innovative? Don't you get sort of embroiled in the day-to-day and you sort of build a set of assumptions based on being in the same place for so long? How do you challenge those? And those are all good questions. So, and I don't have a great answer, but to your point about sort of stepping back, I mean, I remember when I first joined what was actually pre-Advocate was a company called EHS Healthcare, which was the predecessor that merged with another in Chicago to create Advocate in 95. And I remember when I joined in 93, that's how long ago it was, I was in awe of all the people who had been there for 25 years. And like, I remember when Medicare first was started and when DRGs came out in, I think it was 1983, if I'm not mistaken. And now I'm that guy going, I remember when Bill and Hillary Clinton had healthcare reform, and like a bunch of the young people on my team were like, Bill Clinton was president? Yeah. So it's very interesting to have that long-term perspective. So the one thing I would say is, and I got asked this a lot as chief strategy officer, because my job was, and to some extent still is, sort of predicting the long-range future and trying to get our organization prepared for what are those trends that are, and how do we address those to be successful and fulfill our mission. And so my job was to always cry wolf. The world's going to end. Healthcare spending is unsustainable. It's all going to be managed care. All the doctors are going to be employed, et cetera, et cetera, et cetera. And every 3 years we update our strategic plan, or even every 5 years. And everyone would sort of look at me and said, yeah, Scott, you said the world was falling, and it ain't falling. So there is this, and what I've told people is the reason I actually think the world we're living in today is different. Now, you can debate the time frame for fundamental change and transformation of the healthcare system, but I think the thing I always say is that the landscape of people participating in our industry is very different than it was 5, 10, 15 years ago. And actually some of the people on this call and who are part of Startup Health, I think represent that. And I sort of, it's kind of bimodal. There's this whole group of what I call innovative, earlier stage. I don't want to say just startups, but certainly startups, earlier stage companies. There's massive amounts of capital that's flowing in to fund a lot of really interesting and innovative ideas. We're in an unprecedented time. 15 years ago, healthcare venture capital almost didn't even exist. And so to look at what we have today and the infrastructure of a Startup Health, and in Chicago, we have Matter and a variety of other organizations. So that's one fundamental difference, the amount of capital and the amount of innovation and activity and startup and early stage. The other is the other side of that bimodal equation, which is the mega scaled players, both on the technology side and in the care delivery and insurance and consumer health side, whether it's Google participating in healthcare, Apple participating in healthcare, Amazon clearly participating in healthcare, Aetna, CVS, United, Optum. These are $250 billion enterprises or more. As I said to someone, United, Optum generates more free cash flow in a year than we generate in revenue in a year and a half. So the amount of resources available to essentially transform care is just, and the players who are scaled to do it, coupled with that other end, the earlier stage and the capital going there, just to me means that there's no avoiding the transformation and the disruption in the industry. That's just my big picture take from 28 years of trying to do this. And I think this is finally the time it's going to happen.
Yeah. What I'm hearing you saying is that longevity in the industry, it can be a challenge in terms of staying innovative, and yet it gives you this really important perspective, which I know you're applying in a lot of different parts of your business. I think it's a good segue to Advocate Aurora Enterprises. Let's talk about why this came to be now. I mean, you kind of set it up just now, this being a unique moment in time, but what is it all about, and kind of what is your role there?
Yeah, so Advocate Aurora Enterprises grew out of this belief that sort of the germination of the belief was creating Advocate Aurora Health, that our purpose is to help people live well, which means not just providing great medical care, but ultimately providing access to a broader array of health services that, and recognizing that people are increasingly investing in their own health. I mean, while there's a $3 trillion healthcare economy tied to Medicare, Medicaid, and commercial carriers funding it, there's another $1 trillion economy around health where people are paying out of pocket to further their own personal health goals, whether it's your fitness club membership, how you shop for food, nutrition and supplements, exercise, sleep activities, mental resilience. There's a whole giant range of those things. And so what we sort of said is, if we're truly going to impact how people living well, we need to participate in that, what I call that consumer health and wellness ecosystem. 99.98% of our revenue is tied up in traditional healthcare delivery, doctor visits and surgeries and imaging studies, et cetera. And so if we're going to participate in that broader consumer health economy, which is very different, it's funded oftentimes out of pocket, although increasingly funded by health plans and employers, but it starts with sort of being an out-of-pocket, more retail-oriented industry. It's not an area that we necessarily had expertise in. So we said we need to create a separate division. That's what Advocate Aurora Enterprises is that separate division, built to, again, assemble a portfolio of consumer health and wellness products, services, and companies. And I'll just say that, because I get asked this all the time, so I'll kind of anticipate a question that might come up. Our job is not to simply serve the needs of our core care delivery system. And I acknowledge that we're a $13 billion healthcare system. We've been in the community in some cases for 150 years. So there's a lot of, it's sort of like Jupiter with all the moons around it. There's a lot of gravitational pull that Jupiter has. But, our goal is to be, someday be the Saturn, so that we are on equal footing and our own enterprise that will benefit the core, but we're sort of our own enterprise. And so in 25 years, I hope I look back and say we've created our version of what Optum has become within United Health Group. So that's sort of what we're trying to do in a nutshell. And again, the why now is, I will say part of the why now is also the underlying economics of care delivery. For any of you, and probably a lot of you have had some experience with, traditional healthcare, whether it's hospital or physicians or other outpatient, it's a terrible business to be in. It's low margin, it's capital intensive. There's no technology, almost any technology that's putting more business into the hospitals. Almost all technology takes things out of the hospital. So our underlying utilization, despite the aging of the population and the increase in chronic disease burden, our underlying utilization of our core business is going down. Our costs are fundamentally going up and being exacerbated right now by workforce shortages, et cetera. A lot of our suppliers have monopolistic pricing power, whether they're pharmaceutical, drug, or device manufacturers. So we don't have a lot of control over our cost structure, and we have no control over our revenue. So part of this is also a, financial diversification play, as in addition to sort of fulfilling this broader purpose of helping people live well. So I'll stop there, but Logan, you can probe that and take it any way you want.
Yeah, what I want to know is really, what are your primary focuses of investment? I mean, where do you see this going when you could kind of focus anywhere?
Yeah, because
How
$1
do you
trillion
decide?
economy is too big.
Yeah.
That's a giant ocean. So we have boiled this our focus areas down to 3 for now. We're still, in some respects, we're also a startup. I mean, technically as a corporate entity, we're only about 8 months old under the name Advocate Aurora Enterprises, and in terms of having capital available from the parent company, we're only a year old, give or take. So we're sort of a startup. So which means that we're fluid, so things will evolve. But at this moment, we've picked 3 areas within that broader consumer health ecosystem to focus on. And the consistent theme across all 3 of these is, one, large market with growing demand generally. 2, lots of unmet needs, whether they're gaps in services or just a fragmented environment, et cetera. And areas where we think we have some capabilities in our core business that can be brought over and assist Advocate Aurora Enterprises and the portfolio that's assembling to be successful competing in these particular sectors. So we've got 3. One is aging independently, obviously huge issue, huge unmet needs. All the economics say we've got a massive issue with senior care over the long term, lots of it moving into the home. And, we're a national leader in geriatric care. We're a national leader in Medicare Advantage in the core. So we've got a lot of clinical backing and expertise. So we think we've got something there. Second area is parenthood. So it's never, and I've got 2 daughters. One is a rising senior in high school. The other actually just graduated from college. So, and even now I look at people on our team who are raising kids and saying it's like 10 times more complicated to raise a kid in 2021 than it was for me in 2001. And so huge unmet needs, lots of fragmentation. And again, we're a national leader in women's care. We have a nationally known children's hospital, got a lot of clinical depth in fertility and obstetrics and research. So we're thinking parenthood is an interesting place for us to participate. And then the third is what we call personal performance, which is sort of a catch-all, that the idea of aligning mind, body, and nutrition so that individuals can achieve their peak performance. And again, we bring a bunch of interesting capabilities. So one, lots of growth. I mean, the explosion, and any of you who are involved in digital mental health and behavioral health, valuations are crazy because everyone knows there's going to be huge growth. COVID, uncovered lots of issues with mental resilience and things of that nature. So, putting together a portfolio to address that and drawing on the capabilities, we have a pretty well-known behavioral health service line. We have a lot of action in physical therapy and sports medicine and other aspects of exercise. We actually have a fitness business. That's part of that 0.02% of our revenue that's actually not pure care delivery. So again, lots of interesting capabilities that we want to bring to bear around aligning mind, body, nutrition. So those are the three focus areas at this moment.
Those are exciting areas. I mean, what I wrote down was just massive need, impact, and capability. You've identified just huge need. Where can we really move the needle? And then like, where do we also have some capability here and some pieces of the puzzle already in place?
Yeah, I think that's right. You know, maybe the one small thing I would say is because I mentioned this, we want to be fluid in this. So we took an ocean, and you know, I'm from the Midwest. I grew up on the shores of Lake Erie and now live on the shores of Lake Michigan. So we boil it down to 3 large Great Lakes. That's still pretty big, you know,
it is
fishing hole. These are gonna evolve. I suspect some of these get crystallized and narrowed down even further a little bit over time, but that's where we're at today.
Awesome. Okay, Scott, I want to get into sort of how you partner with startups. But before I do that, there are a few questions in the chat. So let's take a moment for those. Let's start with Samit Manier from Wellbrain. Samit, you can come off mute and go ahead and ask your question.
Yeah, thanks. I think you answered some of the questions I had, in the sense that one of the key points I think you identified is the shift towards managed risk plans, and also on this investment component of it. And my question was, were you guys looking at remote patient monitoring, behavioral health, and that? But my overall guiding question is, how do these solutions that you potentially look at from an investment perspective look to drive your future profitability or revenue or other types of solutions? And is there a goal? Because if you're more managed risks, how does that impact your profitability and wherewithal? So
yeah, let me try to parse that out a little bit.
Yeah.
And if I'm not getting at it, you know, push back or crystallize or you know, or probe. But so let me start with Advocate Aurora Health, the broad parent company enterprise. That's where we hold a ton of financial risk related to total cost of care and value-based contracts, Medicare shared savings, global capitation, Medicare Advantage, et cetera.
Mhm.
And and that is where, by the way, they are the reason why we think Advocate Aurora Enterprises can be successful. One of the reasons is because, in addition to acquiring, investing in consumer health companies that on their own merits can be profitable and have lots of growth, we think Advocate Aurora Health, because of its focus on population health and taking risk, will be a customer of Advocate Aurora Enterprise and its portfolio. So we think there's a you know, sort of flywheel synergy that we hope will occur. That doesn't mean that every company we participate in within Advocate Aurora Enterprises must serve the needs of the core. It's not a prerequisite, but it's sort of inevitable that a lot of the solutions we're looking at, you know, are things that, because we have so much financial risk in the core, they're going to want to access these. So I wanted to kind of make that clear. But you know, the way the parent company manages financial risk and you know, is by being really good at population health, and we're really good at it. We're not perfect, and there are obvious areas where we've got a lot to learn still. But you know, one of the bases of the merger in 2018 was that Advocate Healthcare in Illinois. You know, we pioneered back in the early 2000s clinical integration and a variety, and basically taking risk even though you don't have your own health plan. So we've got some pretty deep capabilities to manage the total cost of care, analytics, claims processing, clinical and medical management, utilization management. And, you know, we continue to get better there. So that's sort of how we manage profitability at a high level.
Mm-hmm.
I'm not sure if that's quite what you're asking, because and I'm reading what was in your chat around, you know, digital health and things of that nature. That is where we are going. And that is where I think that is sort of a little bit uncharted right now, is how, because to be honest with you, and this maybe gets to one of the broader reasons why we do this kind of fireside chat, you know, there are probably 100,000 digital
Right.
solutions that can help manage care. And, probably 10,000 of them have tried to call us and get in with us. So, and I'm sure there's another 90,000 who would like to get in with us. And it's just hard to sort through what's real, what's not. Solving a small issue is important, but, we're like any, when you've got 1.5 million value-based lives, you sort of have to go where the big ticket issues are, which ultimately is, diabetes, congestive heart failure, hypertension, and maybe a couple of other things, end stage, renal disease and things of that nature. So, finding a very small point niche solution to deal with, as an example, and this was a company that we talked to, how to deal with OB bundles, turns out wasn't that important to us. Like, we already manage OB and obstetric care pretty tightly. We've got a pretty low, premature birth rate, low C-section rate. Everyone's out of the hospital in under 48 hours, unless there's an unusual complication. So like, how are you going to really manage that and make a difference? So that's again, a little bit of how we think on, maybe a little more on the core. So
Okay.
Samit, I'm not sure I'm answering your question, but that's sort of.
Any follow-up, Samit?
Yeah. No, I think this was good because I asked the first question before not anticipating what else you were going to say. So you answered some of those answers, but
Good.
I think this is a good way. And one last follow-up is just, are you guys pushing forward, or are hospitals? One of the things I'm seeing with behavioral health and what the CMS is doing, trying to move things away from at facility to off facility. But are you guys getting involved with that? Remote patient monitoring, remote patient care?
Yeah. So yes, we are. One of our fundamental themes at the parent company and at AAE is the movement of care to the home, and the home ultimately being kind of the focal point and platform for all future care delivery. Doesn't mean, obviously, we're not doing neurosurgery in your bedroom tomorrow, but technology has enabled and will continue to enable so much more stuff to be either done physically in the home with, an in-home presence, or via technology remote monitoring. So we have an entire division. We call it used to be called home health, and it became post-acute. It's now called continuing health, because at least 50% of all their care is not post-acute, it's pre-acute. And they keep, they also, by the way, are sort of one of the national leaders, in my opinion, humble opinion, a national leader in managing capitated care. So their job is, make the home the focal point of care delivery, either in person or using remote technology. And they're doing everything from the highest end hospital at home all the way down to, some basic remote monitoring and things of that nature. So yeah, and by the way, the one thing we didn't do, because it's a very different business, is what we call in-home personal care. So in-home personal care is typically not, although it's starting to be paid by Medicare Advantage plans, typically not paid by traditional insurance. Some states have Medicaid waivers to pay for it, but most of it's paid for by people out of their own pocket. And so that's a different business. We tried to get into that like 15 years ago and failed miserably. So I'm actually wearing that sweatshirt, by the way. One of the things AAE did is we acquired a company called Senior Helpers on April 1st of this year. They're in that business across 44 states. And the goal is it will be complementary to what we do in the traditional kind of Medicare certified home health space to augment what we're already doing. So we have a huge belief in the home is the future of care delivery.
Okay. All right. Thanks.
Thanks for the question, Samit.
Yeah.
Scott, the main thing I heard in there was neurosurgery in the bedroom. So that's going to be the headline of this blog post when this is turned into a story. Scott Powder says going to have neurosurgery
coming any day now. I'm volunteering to be first. So.
In the home, neurosurgery. All right. We got a question from Dr. Alexandra Greenhill from Care Team. Come off mute and you can ask your question.
All of this conversation stimulated several, but the first one I wanted to wonder, practically, what systems do you use in place right now? You talked about mergers. Does that mean multiple EMRs, or have we coalesced on one?
Yeah, great question. So we did coalesce on one. We're an Epic shop. So, and very quick backstory is Advocate healthcare in 2001 made a fateful decision to go with Cerner. And Cerner never really developed a strong outpatient physician EMR platform, with all due respect, if anyone from Cerner's on this call. I think they've improved, but so we ended up, when we merged, Advocate was Cerner and Allscripts with a small outpost using Epic. To their credit, Aurora was all Epic. They had made that move and integrated, 5 years prior to the merger. So we went with Epic. We've finished that integration the end of last year. And that's been very helpful because we are, by the way, we believe in scale. We also believe in integration. That's sort of, two fundamental, beliefs philosophies we have about better care.
That's fantastic. And my other question is related to some of the sort of inevitable challenge. I'm a physician, and I've spent, I'm not going to say how many years now convincing my colleagues to adopt new ways of practicing. And I'm always interested about more best practices of how do you, let's imagine the tens of thousands of startups, you choose one and you say it's a go. How do you help or facilitate with the inevitable resistance at the front line, especially now that everyone's exhausted post-COVID?
Yeah, it is a fabulous question. So, there's not one great answer to this issue. It's good just to even be aware of it. What I would say is one of the interesting startups that we've been talking to, I think could offer a solution to all this. So I'm going to give them a little bit of a shout out. It's a company called Xealth, spelled Xealth. So kind of like stealth, only Xealth with an X. And they are an interesting organization. Their goal is to become the sure scripts, if you will, for all non-pharmaceutical prescriptions. So digital therapeutics, education content, related services, digital applications, even if they're not FDA approved. And so what they've sort of built is this Epic integration. And what ultimately, if everything plays out, they got, as everyone has nowadays, an AI engine. In theory, if you're the physician, what it should do is, before I come to my appointment with you, this tool mines the EMR and identifies, based on notes and past information and any other things that come up during the actual encounter, and it serves up in the EMR a set of, again, not pharmaceutical prescriptions, but it could be, hey, this person should go to Weight Watchers, or they should be using Ginger. I'm picking on, a behavioral health app. Or in our case, another company we've invested in, Food Smart, which is a digital food and nutrition platform. And so, it then makes it really easy inside the physician's workflow to prescribe, and I'm going to use air quotes for prescribe, or at least recommend these apps or education or services to their patient. And it flows into the patient's portal with a link. And if the company has done API integration with Xealth, you literally get to the sign-in page. And so my dream, because we are now a significant investor in Food Smart, which is, again, digital food and nutrition platform. I can tell you more about that if you want. But my dream is that every one of our clinicians, as we deploy Xealth across our entire enterprise, it's serving up Food Smart as a prescription for every relevant patient that, we have 3 million unique patients that we serve every year. We probably have 10 million primary care visits every year. A big chunk of them probably would benefit from a food and nutrition platform like Food Smart. And if Xealth enables that to be served up and removes the friction for the physician, so you don't have to go educate the doctor about 8,000 digital apps. They just, it's served up in the EMR. It removes a lot of the friction to get clinicians. Because I think while there's an acceptance issue, and you're better informed on this than me, I think there's an acceptance issue, but a lot of it is bandwidth, memory, and simply removing friction from the referral process. So if I have to educate and remind our 8,000 physicians about Food Smart, it ain't ever happening. And by the way, they got to remember Food Smart and Omada and about 18 other apps just for food nutrition and diabetes prevention. Just never happened. But if Xealth automates that, I think that's sort of the holy grail. So that's my hope, is companies like that start coming forward.
Thank you, Scott. This was a great answer, and I'm a huge fan of Xelf on the physician side. I do
good.
experience the patient side, which is you get 18 recommendations and you leave them alone because the day is
Yes.
busy and when do I do this? And so care teams focused on that problem, but I'll follow up with you afterwards to discuss that further.
Yeah, that'd be great. Thank you.
Thanks for the question, Dr. Greenhill. Let's go to Ben Lee from Fortius. Ben, why don't you hop off mute?
Yeah, thanks, and thanks, Scott, so much for the great talk so far. Mine is more of a comment, saying that I love the term you use, peak performance. I think that especially with the recent COVID pandemic, here in Ontario, Canada, we've seen firsthand that a lot of healthcare systems are more so around just keep people alive, or disease prevention rather than human optimization. So, I love that concept you're taking. So my question is, I know you had mentioned some of these, startups that you partnered with, but I'm curious, when it comes to this idea of peak performance, how do you administer this to your clients?
Yeah, well, we're still trying to figure out, I think the holy grail on this is, at least our belief right now, and I'm not sure if this is where it's going to go or not, but right now is, so the challenge is, we believe, kind of philosophy is, you've got to align mind, body, and nutrition. And so mind is mental resilience and, personal, self-awareness and self-actualization, all that good stuff, the top of the Maslow's hierarchy. Obviously, but if that's all you do and you don't, you're not physically fit, or, physically challenged, or you're not eating the right things or getting the right amount of sleep, you're sort of never going to fully optimize. So what our thesis is that that while lots of players are dealing with one or the other, no one's brought a portfolio together and then made it really seamless for customers to access those things. So you sort of have to kind of find them on a one-off basis. Now, I will confess, I'm the least likely person to use any of these solutions other than the food and nutrition and the exercise stuff. Like, I'm try to take care of myself and I run a lot. So, but like the mental resilience stuff, not my bag. And so the team I have not become fully convinced that if we unify a platform around all this, that's going to somehow differentiate. So that's our working thesis right now, is can we unify and bring a bunch of that stuff together, or partner with someone to bring some of those things together. So we might bring the point solutions with a partner who can put a platform on top of it. So that way, again, you don't need to go and find this app for sleep and this app for your exercise management. And by the way, a lot of this is predicated on coaching, whether it's virtual or AI enabled coaching, or even in person at some point. So again, all things we're still trying to figure out.
Interesting. No, that's a great answer. I think what you're describing harkens back to the days of antiquity, during classical education, when you had to be mentally, intellectually fit, physically fit, and psychologically fit. So it sounds great. I'd love to connect with you later on, just to talk more about this topic, but maybe we'll do that another time. So thank you.
Absolutely. Yeah. And by the way, just as Logan, you may be, I know we'll run out of time before we can get to everything. And, but it's worth 1 second, and you might've been going there, for me to just say a little bit about, so that way there's no false expectations, our investment approach right now. So first is, I want to encourage, I'm open if anyone wants to reach out to me, and LinkedIn is a terrible way to do. I like getting connected by LinkedIn, and it's okay to send me a message, but then I'll route you back through my business email. So that way, like, if we're gonna have a conversation, I can connect you with my assistant. Otherwise, we'll literally never talk. So that's one thing. I'm open to any outreach. And in some cases, I might end up triaging to someone else, either in my team or back in Advocate Aurora Health and the parent company. But just in terms of us specifically, we try to invest. Again, although I'm a startup, I do have some audacious financial goals that I have to achieve for Advocate Aurora Health over the next 5-6 years. So we're not a VC or PE arm. We're not looking for exits, but we are looking to invest in companies that can generate a sustainable, recurring, and accretive EBITDA over time. We tend to focus on companies that are, that we've got line of sight, like very quickly to 10 million in revenue. And ideally, are going to be EBITDA positive within a year or so. So I just wanted you to be aware of that. So again, there are going to be exceptions to that. And as we build out our portfolio, we'll have more latitude to do some earlier stage things, especially if they kind of synergize with things that are in our platform. But, our first couple of deals, Senior Helpers was a buyout, and, they're making pretty nice EBITDA margins right now. Food Smart is, gonna exceed 10 million. I mean, they were kind of at 10 million last year. They're going to probably double that or come close to it this year. And so those are the kinds of deals we're kind of looking at this moment, just purely from an investment standpoint. So I wanted that to be out there.
That's
but
helpful.
I still welcome all inquiries. I'd love to talk further with any of you, because even if we don't do a deal this moment, one, there might be something to connect you into our core. Two, it could be that we want to stay in touch. Three, there could be synergy with some of our companies or interesting other partnerships. You may not even be looking for, cash at this moment, or, equity investment. So I am going to welcome any and all outreach over time.
Appreciate the question, Ben. We'll make sure, Scott, that anyone on this call that wants to reach you has an avenue to do so, and we can help make sure that that's smooth. You've really laid it out nicely in terms of who you partner with and what that looks like. What advice would you give to startups who are looking and saying, maybe that's not me today, but I want to establish my business such that I'm going to be able to partner with a large health system like Advocate Aurora in the future? And I'm really setting myself up for success early. I mean, you did a lot of review of startups through Matter, I believe, and you've seen all those decks. So what are some words of wisdom you have about kind of setting things up right from the beginning?
Yeah, well, maybe what I'll do is tell you what's gone wrong. And maybe
Perfect.
These are usually failures, or at least snafus, or better lessons learned. Actually drawing on what we did, we're actually just wrapping up our third health tech venture challenge that we do with Matter. And by the way, we'd welcome doing some of these things with Startup Health as well. And we're kind of one of the founding investors in Startup Health, so have a lot of respect for what Startup's been doing.
I didn't mention that, Scott, at the top of the hour, but I know it's been a fantastic working relationship, having Advocate Aurora as an investor and a partner all these years. So
and to give credit where credit's due, Aurora did the deal to invest in Startup Health before our merger, and I just inherited the relationship. I went to my first Startup Health festival, and right around the JP Morgan a couple years ago, and I was actually kind of shell shocked, because there was like thousands of people and lots going on. I'm like, I don't even know what to do. So I'm getting better at navigating that, and I hope we come back together. But and again, but this is just lessons learned, or things that didn't work well. So, and some of this is just lessons learned on our end. So the company that that won our first health tech venture challenge, this is going back 3 or 4 years, really interesting company, and we liked what they were doing, and we started partnering with them. And then, like all good founders, and I'm learning this from, kind of running my own startup now, they changed their strategic direction opportunistically. And therefore they were no longer interested in pursuing the things that we wanted to pursue with them, because they found a new opportunity. It was related, but it wasn't in our wheelhouse. So I think my lesson there is just, if you're still fluid with what you're trying to accomplish, or the means by which you're going to achieve your growth and your vision, I think being upfront with the health system about that, and again, it is, I don't think health systems, we are not used to changing direction quickly. We're not used to changing direction generally at all. And so, we sort of felt like we got burned a little bit, because these founders, by the way, the other thing is, I always tell people, try not to have a business whose main source of revenue is selling to health systems. Now, probably all of you have some aspect of that, but someone once said the sales cycle to get into a health system is typically longer than your Series A and B rounds. So it's just a very difficult process. So, but again, so one lesson learned, again, founders can be fluid, and they should be, and that's part of being a startup, but that's not aligned with what big health systems are used to. And so that fluidity can be a challenge. I'd say one of the other things that, I think this has certainly been something like our job, we are a little bit, even though we're typically tax exempt, we are a little bit like for-profit companies who have to, who basically have to make earnings forecasts and live up to those. I have, my surprise, every single company that we've ever looked at investing in has a management presentation with, quadrupling of revenue in 2 years and then quintupling it in 3, and getting from, 3 million this year to 100 million in 3 years with, 30 million in EBITDA. And surprise, not one, there's a 100% failure rate on that. So I don't really know what to do about that. There seems to be a general acceptance of completely, I guess, unbelievable management projections, and maybe the VCs are just used to that, and they
What
sort
is
of
that,
lead
Scott?
that.
Maybe you could unpack that for us. What is that? The desire for that overly confident expression, and yet the knowledge that you might be overreaching.
Yeah, well, I'd love to hear from the folks on this call. I mean, I think it's a competitive market for capital, and so you want to put, within some level of believability. And quite frankly, there's a buyer beware. That's why VCs are generally pretty good at diligence. And PE guys are probably even better at financial diligence. And that's one of the reasons we like to partner with institutional investors in certain cases, because we're not sure we're always the best at that. But so maybe that's just the name of the game. But I will tell you, at least for us, it's the challenge. And maybe this is insight as you think, down the road. The challenge for us is, we've got to, my job is not just strategic. That's the first and foremost thing, is to fulfill our strategy and our purpose. And that's why we're doing what we're doing. But if I only fulfill our strategic objectives and not our financial objectives, I'm a failure. If I've only fulfilled financial objectives, but not advanced strategic objectives, that's also a fail. And on the financial side, I need to be contributing to the financial health of a low margin, generally declining business, which means that I can't go out and invest in a bunch of companies that I'll say we're going to be at 100 million and tell my board, these guys tell us they're going to be at 100 million. And then every one of them fails to even come close to meeting expectations. Again, in a Wall Street world, you get punished by stock price, and that's what holds you accountable to sort of under promise and overperform. So that is an incredibly important, for me, seeing some credibility with management projections actually gives me comfort that we're talking to people who are willing to be reasonable and realistic and transparent about the state of their business.
That's a great point, Scott. I got a comment here from Jean Ann from Unaliware about projections. Jean Ann, you want to hop off mute?
Sure. So Scott, Unaliware is a wearable OnStar for people. So that's what we do. And my background also includes decades in corporate, in addition to my entrepreneurial world. And I'll tell you what the VCs do is they actually decimate your forecast internally.
Yeah.
And so what happens is, right, so you've got the people right out of business school who actually, take the deal flow information in, and then they fill in the little database grids. They take that 100 million, they turn it down to 1 million, and that's how you go into the internal grid, right? And I guess it would be 10 million. But anyway, that's how you go into the grid. But if you were to give them a realistic forecast, when they decimate it, you don't have a forecast that's interesting enough for anybody to ever follow up with you.
Yeah, I hear
so
you.
That's what's going on there.
Yeah, yeah. And by the way, we do a haircut analysis. We call it the haircut analysis as well. And I get it. And I'm an advisor for a pretty reputable venture capital fund. They're based in San Francisco and Nashville. And I sort of see what they're up to, and we're investors as an organization. We're an LP in a handful of VC funds, so I get it. It is sort of a weird rat race, and it's sort of a self-fulfilling cycle. And I think that is one area where perhaps, we can be different. I hope, one of the things we are going to struggle with, and it's already come up, is we're a strategic investor. Like the venture capital investors get really nervous about us because they know as a strategic, they assume our ultimate goal is take control of the company. And if we have control, we can limit their upside in the event of a liquidity event. So that's an interesting dynamic that we face, for what it's worth. But yeah, I understand the root cause of it. I will just say that at least we are trying to be a little bit different, because we just are, and that we look at. I think we want to get realistic numbers and have the conversation and then decide. And by the way, we start with, is it strategically aligned? That's our first goal. Then we'll deal with the numbers. So anyway, it's going to be interesting how we evolve relative to the VC world.
Awesome. I mean, in one sense, you do the same thing, internally, right? When you're actually setting what are your financial goals that you're going to get your bonus payments on, you set them as low as you can, and your management sets them as high as you can, and then you guys, I mean, it's no different. It's the same thing, yeah. Except that the multiples are so much bigger from what it is you have to show a VC.
That's right. That's fair. It's good.
Yeah. We got a couple more comments. We might not get to them. Well, you know what? We're just going to make these our sort of final insights for the conversation. I want to get as many voices as possible. So Sumit, why don't you share your thought here?
Oh, no, I mean, it's a similar comment in the sense the last 3 VCs I spoke to this past week, as they're in the middle round, it's like, we want to see the $1 billion valuation, right? So, and I'm like, so I've been around the block, and I know I've done it backwards and inside out. As the previous person, I've tripled the costs and 1/3 the revenues. Then it doesn't fit into their equation, right? So they want to see the high thing, and then they told me, Sumit, it's like, let us do that stuff on the back end, but just show us the sexy stuff so it sounds sexy.
Yeah, it's an interesting conundrum.
And Dr. Greenhill, your last note.
I just, Scott, it's wonderful to deal with people who know the realities of how complicated and messy it is, and yet still persevere in changing the world. And so I think your comments about exaggerating, like I do have an impatience and a frustration with a lot of the pilots in healthcare that are aiming to change the life of 1,000 patients. And some of the successes we've had with COVID is like, look, 1 million people use this app. And you're like, you do realize there's 330 million Americans. And so 1 million is not even a percentage. And so can we somehow meet in the middle and increase the size of programs and expectations and achievables without going as crazy as some of the VCs want us? That would be my plea for the entire industry of healthcare.
Yeah, I think that's really good. Yeah, the one other thing I would say on that note is the reason that now, while I hate businesses, and I say this as an investor right now, whenever our team brings up a company that ultimately is dependent on revenue by selling to health systems, I get really scared because I know how hard it is from being on the other side. And I've done my share of slow no's, and you've probably all experienced that as well. But I would say that of all the places where you can actually make a difference, the health system is the place, because while we are still not nearly as scaled as we need to be relative to a United or an Aetna CVS, Advocate Aurora, as an example, I said, we serve 3 million people a year, unique lives, 10 million visits. So like if we could get more health systems to come together and work in a consortium, and we're doing this a little bit more now in a consortium manner where we can try these things and do it at scale and start impacting 20 million, 30 million people, to your point, Doctor. That gets interesting. So that is the promise of the health system. It's just, you got to cracking the code of the health system is really hard. And they're equipped to run day-to-day operations, not to kind of field phone calls from really interesting startups. It's the way we're kind of built. So that if Startup Health can help figure out how to crack the health system entry code, that could get really interesting. And I'm glad to be a resource. Again, 28 years I've watched a lot of things flounder through our system, and I've let things flounder myself, so I know exactly what happens.
Well, Scott, I think that is a great moment to end on. We're up to the top of the hour here. Scott, thank you so much for taking the last hour with us and being so candid.
My pleasure. And I just commend all of you for the work you're doing and for your commitment to trying to improve health for the world and for our country. So thank you for what you do. And thanks to Startup Health as well. It's noble work that we're doing.
Thanks for listening to Startup Health Now. Startup Health invests in health transformers from around the world who are committed to achieving audacious health moonshots. If you want to learn how you can join this community of entrepreneurs, or if you want to connect with one of our 350 companies, go to startuphealth.com. If you'd like to learn how you can invest in our Health Moonshot Rolling Fund in collaboration with AngelList, go to healthmoonshots.com. Thanks for listening to Startup Health Now. We'll be back next week.